So we have all of our experts here today. With that, if you've got questions, please put them in the chat. We'll try to get to them. And with that, I'll turn it over to Dr. Baumgarten to really kind of cover where we are with COVID-19 and discuss what we know about the Omicron variant at this time.
Good afternoon, everybody. Thanks so much for joining us. Hope you had a good Halloween and Thanksgiving and were able to enjoy that before the news about Omicron. I was just telling the group that, waking up to that on Friday morning, at least we got a nice Thanksgiving and hopefully y'all had a good holiday as well. We have fortunately here at Ochsner Health seen a decline in COVID-19 overall. If you remember when we had our peak associated with the fourth surge in Delta variant in early August, we had about 1,100 patients at most across our system in the hospital. Currently, we average around 40 to 50 a day, so we've plateaued in that range. It goes up and down a little bit depending on the day, but fortunately we have not seen yet a rise in that number of hospitalizations across our system. As you well know, in Louisiana, we have not yet seen the Omicron variant, not in Louisiana nor in the United States yet, but it is close by and we know it's a matter of time. Currently, the WHO has declared this variant named variant of concern, which means we have to keep a close eye on it. As you know, it was first reported in South Africa and then has been reported in multiple countries over the past few days since then. We again are grateful to the scientific community that shares this information and at how rapidly we are able to get this information out there, and then how rapidly scientists are able to work on the data and work on technologies such as vaccines to help. It's still pretty early in the game to know how transmissible or severe the variant is, although there's some information from South Africa even today that their rates of positivity of this variant have risen. And so it seems to be highly transmissible. We're still waiting for more information about how severe the cases may be. We do know that they are seeing it in their younger population as more of a mild to moderate disease. And their hospitalizations have been in those that have been more significantly impacted by age or by comorbidities, but we still don't have that exact data to know for sure how severe it will be ultimately. We also are waiting for a little more information in terms of vaccine efficacy. We'll talk a little bit more about that, but that testing is undergoing currently with vaccine manufacturers. And we do know, fortunately, that we do have vaccine manufacturers that can get vaccines ready pretty quickly if there is a concern and if there is a variation in the vaccine that needs to be made for this variant. We have an armamentarium here now that we didn't have in the first surge. We know that we have medications. We know that certain things work, the common sense things that we all should do: masking, social distancing, washing hands, especially for those that are vulnerable or have symptoms. We have testing available for those that have symptoms, or if people are traveling or are returning from travel, certainly testing is appropriate. We have over-the-counter tests now that we didn't even have in the third surge. So that's now available as well to help those in the community evaluate and decide what they should or should not do when it comes to social settings. With us today, we have Dr. Amy Feehan. She's our clinical research scientist at Ochsner. She has been working closely with the Louisiana Department of Health regarding sequencing of virus from COVID-19. So we'll turn it over to her for a little update from her standpoint.
Thank you, Dr. Baumgarten. And apparently, unlike everyone else, I was looking at all of this unfold on Thanksgiving and kind of doom scrolling on Twitter. But like they said, there's a lot that we still don't know. However, we're in a really good place. We started a collaboration with the Louisiana Department of Health over the summer that actually allowed us to detect Delta in our population a couple of weeks before cases started surging. So with what we knew about Delta and what was going on in India, knowing that that was in our population allowed us to really prepare. And we think that something similar will happen now. We have, surveillance sequencing ongoing through cooperation with our urgent cares and emergency departments. And so having that in action already, and we've worked out all the kinks through the Delta surge, we're going to be able to tell pretty quickly when Omicron does arrive and what it does in our population. So we're super grateful for that. We also work directly with LSU downtown at the Health Sciences Center, who performs our sequencing, and bioinfo experts, who is our bioanalytic pipeline and bioinformatics group that we work with. So as Dr. Baumgarten explained, we're waiting on more data to know the potential clinical impacts and all that kind of stuff. But we have had a lot of concerns internationally about this particular variant because of the sheer number of mutations found in the spike protein. In Delta, there were 9 mutations compared to the original Wuhan sequence. And for Omicron, it's 32 mutations in the spike protein. And mutations are not always bad. They happen kind of naturally as a result of many iterations and life cycles of the virus. It's just when they happen in that rapid of a fashion, or kind of a lot of them pop up all at once, it definitely gives us pause. And so we'll still need a lot of time and experiments to determine what all of those different mutations really translate to in the real world. But with that, I can turn it over to Dr. Kimberly to talk about some ways to mitigate this maybe impending variant yourselves.
Thank you, Dr. Feehan. I had trouble getting off of mute. Can you hear me now? Okay, thanks. So Omicron is widely being covered in the news, and it is causing a lot of angst. We're excited about the holidays, excited about spending time with our family and friends for Thanksgiving, just to be surprised by the news breaking on Thanksgiving Day and the day after about Omicron. So it's got a lot of attention worldwide. It's all over the news, it's on social media, and it's causing a lot of angst. And I understand that, but it's not time for people to panic. What we want is the public to be prepared. There are things that we've been doing and saying for the last 2 years that we know that work, such as wearing masks, social distance, washing your hands, staying home when you're sick. So none of those measures have changed. And, I get that we're all kind of tired of COVID and want to celebrate holidays like we used to, but unfortunately, again, this virus is not done with us, even though we're done with the virus. And so our mitigation efforts have been laxed over the past holidays, Halloween, Thanksgiving. And so the risk even of the Delta variant, that's still primarily the one that's circulating in this country, is to assess your own personal and family's risk and to put your safety measures in place. We know that the vaccines are highly effective in preventing serious disease. While we don't exactly know the effectiveness of the vaccines against Omicron, it appears that there is still lots of activity still yet to be measured with the Pfizer vaccine. So there's some new data that was released today out of Israel and South Africa, and it appears in these preliminary studies that the Pfizer vaccine retains pretty good efficacy against this Omicron variant. Now, what you can do is, if you're not vaccinated, please get vaccinated. If you're over 18 and have been vaccinated more than 6 months ago, please get that booster, because we know that the 2 preliminary shots plus the booster gives us the most protection. And again, this vaccine is now available for children as young as 5 years old. We know that children can get sick from COVID. We know that children can spread COVID. And so please consider getting your child vaccinated to protect the child from further illness. So again, we are following this very, very closely. This is a little bit unusual in the sense that we've had a little bit of leeway with other variants of concern. So we had, it was sort of posted to the World of Science on Wednesday, and by the next day or so, World Health declared it a variant of concern. And so we didn't have a lot of preliminary time to to look at this and really, kind of get ready for it. So it kind of came as a surprise, and it's going to, realistically take 1 to 2 weeks for us to really get the data to be able to make certain, assumptions and certain statements regarding what Omicron really means in this COVID pandemic. So, Nicole, I think we're ready for questions.
Right. Thanks, Dr. Kimberly. So I see some questions coming in the chat, and it looks like Dr. Feehan, we've got some on sequencing. So the first one, will there be sequencing of previous samples to ensure the variant isn't already in the US? In other words, will there be retroactive efforts?
So the really amazing thing about how this pandemic has shaped open data and data sharing. So every single sample that I sequence, we upload to a server called GISAID, and everyone else who's doing any amount of sequencing is also uploading there. So we've been doing that in an ongoing way since April of 2020. So we have sequences already that are all banked in this public repository. And that's kind of how this lineage was first identified, was that those authors uploaded those sequences to this database, were able to compare it. Sequencing kind of gives you like a family tree of the virus. And so we saw that this one is not related to Delta at all, but we can see the similarities and differences between it, Delta, everything anyone has sequenced previously all around the world. So we have a lot of clarity on when things popped up. And then you can always retroactively check and see, is there, a particular mutation? How many times has that occurred previously? And so that data is already there. We do at Ochsner ongoing sequencing for the LDH in a prospective way. So each week when we get positive samples, we sequence those. But we also have an additional grant funded to take some more stuff out of our freezer that we saved from a while ago and just didn't have funding to sequence. So we're actually doing prospective and retroactive sequencing all at the same time. But there are no indications that this was already here, prior to these announcements. So hopefully that answers your question.
Thanks, Dr. Feehan. I think you kind of covered too how much sequencing we're doing. I don't know if you have anything to add there.
So I can tell you that we've clocked over 1,500 sequences from Ochsner samples. And worldwide, I think we just hit over 5 million within the last month. I think the 5 million mark was sometime in the last month. Not me personally, but everyone collectively.
Yeah, I don't think you'd be able to, I don't want to know 5 million secret cases. I don't want to. Okay, thank you. We're going to stay focused really on Omicron today. So I see we have some questions about staffing in the chat. We can handle that for right now. Our staffing levels are okay, but we can handle some of those questions. If you have some other questions, you can send them to pr@ochsner.org. Other questions on Omicron?
So, hello, this is Emily Woodruff. My question about staffing is in relation to Omicron. I don't know if you can address that. It just seems like they're pretty related. So, yeah, it's not just about staffing, it's about how this variant might affect staffing.
So I'll take a shot at that, Emily. So what we are thinking that Omicron might be like is, as Delta was more transmissible than earlier versions of the virus, Omicron may be more transmissible. But what we don't know is whether or not it causes more severe disease and more severe disease requiring hospitalization. And as Dr. Baumgarten mentioned, we were up to 1,100 patients at the height of the Delta surge. And so, and certainly that stressed the system, it stressed everybody to a lot. But the point being is that we have no way to predict if Omicron will be similar. But if it turns out to be like Delta, we'll flex and we'll figure out a way to take care of the patients. So It's hard to model something. We don't exactly know what its reproductive number is and such, but again, that's why we're trying to understand all the data coming out of South Africa. It looks like their hospitalizations are increasing, but what we're learning now out of South Africa is their amount of fully vaccinated population is pretty small, and the studies range from anywhere, depending on who you read, but generally about 30 to 35% in the South African area. And so, so that makes 70% vulnerable. So we need to understand that better, similar to what we had with Delta when we only had about 30% of the Louisiana population vaccinated. We saw Delta surge in the unvaccinated people. So what this looks like remains to be seen over the next week or two. But again, we'll staff accordingly as we need to.
And I would just add to that, there's a question about the vaccine booster. One of the things that I think we always get asked about, one of the themes of questions that we get asked about is, what about somebody that's had COVID before? Do they need a vaccine or a booster dose of vaccine? And there is preliminary evidence that even those that have had prior infection with COVID and are unvaccinated fare worse than those that are vaccinated. So we continue to encourage anyone who hasn't gotten vaccinated to start the vaccine series. And then, as I think most of you know already, the CDC yesterday strengthened its language around booster doses of the vaccine, because we do know from data that the titers and immunity wanes over time, whether that be from vaccines or from natural immunity. So in any event, the way to boost that immunity is through getting a booster. This specific question on the chat is, should we go ahead and get a booster now? And the CDC strengthened that language yesterday from those over 18 may consider getting a booster to everybody over 18 should get a booster. And that's the reason, because you want the best immunity and the highest amount of immunity you can have, especially when we know that there may be this variant in our future. So we are encouraging everybody to get the booster now. If there is the possibility that there is another booster that needs to be developed, then we will make recommendations then. But remember, any sort of vaccine takes 7 to 14 days to develop full immunity. And with this, we've always talked about 14 days being that confers full immunity. So you don't want to wait to get your booster. You want to go out now and get the booster. So regardless of what's going on with Omicron, why not get your booster now? That's what is recommended. That's what we've been talking about. So now is the time to get it. And certainly with this looming, we need to make sure that we do everything that we can to prevent further illness and further hospitalizations in our community. To Emily's point, we don't ever want to see these numbers rise in our community again, resulting in hospitalizations and death. And certainly by getting a booster, that is the best way to prevent that from happening.
Y'all, do we have any other questions? Okay, I see how we have a question from down in the bayou. So about people who work in the oil field industry can be called to go to the Persian Gulf, South America, North Sea, among other places. Any advice about the safety of travel like that?
Can I jump in there real quick? My collaborator actually directly works with a couple of the oil companies, and a lot of times they have industrial hygienists who are keeping track of not only cases and infections, but doing sequencing themselves. So I think with a lot of testing that those companies are particularly careful because it costs so much to lift people off of one of the oil rigs. But I just thought I would add that anecdote that they are being particularly careful about their employees, from what I can tell. But testing really will help mitigate a lot of that, I think.
Well, and I think that is why we are encouraging, and LDH, our Louisiana Department of Health, sent out a reminder yesterday that anybody that has been traveling internationally should be tested 3 to 5 days upon their return. And so we are encouraging that in those that travel internationally to seek testing 3 to 5 days after return. And that testing was specified by Louisiana Department of Health to be PCR testing. So we do want to emphasize that that is the recommendation by the state at this time.
All right, thank you. Do we have, do y'all have any final comments? Anything we didn't cover so far?
And I would just add, again, while we don't know the exact efficacy of vaccination against Omicron, we do know that all the coronaviruses share similar structures. There may be nuances and mutations that cause different things in the variant, but at the end of the day, there should be some protection against Omicron and maybe other future variants that have not yet been identified. And so I think, we continue to say that vaccines are our best protection, that we need to continue our mitigation strategies based, masking, social distancing, hand washing. There's a question in the chat from David Mitchell about whether or not the state should change any of its recommendations. I think the state has been very proactive of looking at the data, watching the positivity rate and making changes accordingly. And we don't have the data at this moment in time that would suggest that the state should make any changes at this time. So again, I think that the data has driven the decisions in our organizations as well as, what the state guidance has been, and we should continue to look at all those things that we're measuring. And so, just keep vigilant and understand that we don't have all the answers today. And hopefully this story will unfold with some concrete recommendations in the next week or two.
Can I just add to that? You also don't have to have a mandate to make some, mitigation efforts for yourself. One thing that I really appreciate having this year that we didn't have the last holiday season are the over-the-counter, at-home rapid tests. There's no reason why they would not detect Omicron. And so they're a really great tool to, they cost about $10 a piece, take like 10 minutes to administer. You just swab yourself. And then you can know on that day that you're going to go to an event or see grandma or whatever, that you're not contagious at that moment. So I would really advocate for the use of those, which we didn't have last holiday season.
Thank you. Dr. Baumgarten, anything else?
The other point that I always think I like to emphasize is that this is an individual scenario too. So each individual has to decide what's safest for that person, whether they're immunocompromised, whether they're elderly, whether they may have other medical conditions that may impact the efficacy of the vaccine and impact decisions about travel, about social distancing, about masking, about gathering. So I would just encourage everybody to consider their own individual situation as well. And the other caveat that I would always like to talk about is if somebody's having symptoms to be tested. We've talked a little bit about, there's other viruses that may circulate at this time of the year, and certainly masking, hand washing helps with all of these illnesses. But if you are having symptoms, to seek testing, because we do want to be sure that somebody doesn't have COVID, even if they have a runny nose or just mild symptoms, still seek testing to be sure that there's not spread to others around you.
Right. Thanks, everybody. We appreciate your time today. And as we learn more, let us know if these briefings are helpful. We'll continue to do them and really answer your questions as we have more information available to us. So stay safe out there, and we appreciate you getting out the messaging to everybody.